Hi, this is Usha Tiwari. Thank you for listening to another episode of The Indian Caregiver. Today, I have a very special guest and a very dear friend, Evan Haller, who is the Senior Public Policy Manager for the Alzheimer's Association. We're going to talk about public policy in the Alzheimer's dementia world, as well as informing you how you can become proactive, whether it's in our state of Florida or in your state. So welcome, Evan.
Usha, thank you so much. I mean, it's such a pleasure to be speaking with you today. We've had quite a journey in advocacy over the last couple of years, so I can't wait to share that with all of your viewers.
Yes, and actually, Evan and I met via LinkedIn. I was newly introduced into the caregiving world, and when I realized how frustrating this journey can be, and having worked for elected officials, my mind was determined to make a difference and to work with the Alzheimer's Association to advocate for resources and for legislation. That's where, my passion is. I didn't know who to reach out to. One individual never reached out to me. I think I called the generic number or email, and I did my research on LinkedIn and came across Evan's profile, and I basically stalked him and bombarded him and just said, I want to write this article, but I want to include resources that include the Alzheimer's Association. And I think it was that January, a few years ago, that Evan and I connected, and since then, there's no looking back.
No, I mean, Usha, I remember exactly where I was sitting. I was in a conference room in our Central North Florida offices. I remember you had sent me multiple messages, and I'm thinking, who is this? Do I even know this person? And I remember the moment we connected on the phone, I knew that we would be on this journey for years to come. And I'm just looking back and you bringing that up. I'm so blessed that you did hassle me to get connected, because I mean, you've done amazing things in advocacy in the Alzheimer's area in the state of Florida. So I'm just so blessed to work with you.
Yes, and besides, our interactions with elected officials, you've also helped me make sure facts are good for articles and stuff to be published locally as well as nationally. So I appreciate all the support. You and the advocacy team are a great resource. So let me introduce our viewers so they have a understanding of who you are and why you truly are a rare gem in the advocacy world. Evan Haller is the Senior Public Policy Manager for the Alzheimer's Association, where he helps advocates repackage their personal journeys with Alzheimer's and other forms of dementia into positive messages. That helps create change in the state of Florida. Evan works with advocates to help forge strong relationships with their state and federal elected officials to help educate them and raise awareness about how this disease greatly impacts constituents here in the Sunshine State of Florida. So let's get right to it, because we have a lot of material to cover. Evan, let's talk about the Florida advocates, why they are special, and what we have accomplished.
Yeah, no, it's a great, honestly, first of all, the advocates and our volunteers in general are the heart and soul of the Alzheimer's Association. We're the largest voluntary healthcare organization dealing with Alzheimer's disease, and solely fueled by our volunteers. So honestly, we would be nothing without them. It's a true pleasure and honor to get to work with advocates and volunteers on a daily basis. I just couldn't imagine doing anything else. So why Florida is so important, and this is a great question, because Florida is the second highest prevalent state across the country for Alzheimer's disease. We have 580,000 Floridians currently living with this disease, and that number is increasing every single day. We're, like I said, the second highest prevalent state, right behind California. So Florida is ground zero for this public health epidemic. And it just presents very unique challenges for a person living with Alzheimer's disease and their caregivers. So advocates in this state are incredibly valuable and incredibly important. And I love working with them and empowering them, just like you, Usha, to meet with their elected officials. Because one thing I wake up and remind myself every morning is if we're not advocating, in a positive way to our elected officials about something we are affected by and deeply care about, then who will? So I really love that you brought that up, and Florida is a very important state. Again, we have one of the largest aging populations in the state. So this disease and the effects that it kind of has on families across our state and across the country is not going anywhere.
Yes, and I also want to, speaking of advocates and the Alzheimer's Association, the advocacy team in Florida does a wonderful job educating advocates on social media. I think that you ease the discomfort levels for those who are not tech savvy or feel comfortable posting on social media. And I think, because of that, that helps a lot in our state, bringing attention to elected officials about the importance of this, how we create a social media movement when we need to.
Yeah, no, and you're absolutely right. I think social media has really created a vehicle for us to connect with our elected officials, not just during the pandemic, but just in general, because a lot of elected officials, members of Congress, state representatives, state senators, they're all on social media platforms like Facebook and Twitter. So it gives us a chance to keep reminding them and share stories about our advocates. Like Usha, you and I have made many videos, trying to share your story and your caregiver journey with your elected officials in your area, and they've retweeted, they've responded, they've resonated, they've remembered those social media interactions when we're on the Hill meeting with them, or when we're in Tallahassee meeting for our state advocacy days. So it's just been a great opportunity to really continue to raise awareness and get that message out.
I think also you guys, for me working professionally, I for about 13, 14 years working for elected officials. What also draws my attention is that you spend a lot of time, you, Michelle, and Jen, training the advocates with materials, with manuals, just making the journey more comfortable.
Yeah, training is really important. It's just a lot of advocates will come in, or not a lot, but some advocates will come into this process and they'll be a little bit nervous. They'll, maybe have not talked with their elected officials before, might be nervous about going into an office and meeting with an elected official. But I think our training and the guides that we have on hand that are digital and printable really help, because it just makes it easy to share, facts and figures and hard numbers and data with our elected officials. And also pretty robust pieces of legislation that we've run in the past couple of years. So training has been something we've really strived for here in Florida, and something that I think we do a really good job at.
Yes, you do, definitely. And, going into our next question, which is, I know it's quite extensive information to absorb, but I do use those trainings that are sent, those one-pagers, those fact sheets. I do use it, to publish it on my own social media, as well as if I'm writing articles and stuff. So they are valuable and much appreciated as well. So Evan, I would like for you to spend some time discussing the federal priorities. If you can touch upon some success stories and some of our champions in the Alzheimer's legislation community.
Yeah, no, that's another good question. We have I won't try to spend too much time on this. I'll just try and give us a nice overview. Every year we have a lot of really robust federal priorities that we work with advocates and meet with their elected officials. So this year is no different. Being the second highest prevalent state, we got to have some really good priorities out there for our advocates to talk about. So we have about 5 federal priorities this year. So I'm just going to do a little, just an overview of each one. And one of our most robust pieces of legislation is the Comprehensive Care for Alzheimer's Act. And so just a little bit of background information. There's over 95 individuals who are living with dementia that have one or more chronic condition, and which making the management of their chronic conditions and dementia very, very complicated, as cognitive impairment will do. And individuals with dementia rely heavily on family members to provide a large amount of care, which is often very intrusive and exhausting for the caregiver. So basically, under the current system, many practices can't afford upfront costs of developing, implementing, and sustaining a dementia care management program. So instead of paying for fee for each specific service, providers, we think and we believe, should receive an annual per patient payment for all services provided under the program. So it's called a dementia care management model. And this is a model that we use for cancer and joint replacements and all that kind of stuff. That's really worked. It lumps everything in under one system. And this structure allows dementia care management programs to be financially feasible for healthcare providers and practices, and especially for smaller practices and rural practices, which Florida is full of, and also inner city healthcare centers. So the structure for a dementia care management model would provide services such as the development of the dementia care plan, care coordination, and navigation, and also one of the most important things is the caregiver education and support. You're a caregiver, Usha, so what the burden, and I don't say burden in a negative way because we're caring for people that we love, but it's very hard.
It's a realistic
job.
burden. It's a realistic burden that can happen to anyone at any time.
Exactly. It is anyone who has a brain can get Alzheimer's disease. So any one of us can be in this situation, and I know you and I both deal with this in our family. So under this care management model, it's also ensuring patients have access to an interdisciplinary team of providers that have dementia care expertise, and also it reimburses providers through a capitated payment and incentive payment based on performance. So that's kind of our big, really big, robust piece of legislation that we are, us and as policy managers and all the help from the advocates, I believe does a lot more in this realm, are trying to push through the federal government right now. Mm-hmm. And then, so we have two other pieces of legislation, and that was the big one, so I wanted to go a little bit more into that. We have an Alzheimer's Caregiver Support Act, and another little bit more background on this. We found that nearly half of all caregivers who provide help to older adults do so for someone with Alzheimer's or another form of dementia. And in 2020, family members and friends of individuals living with dementia provided unpaid care valued at nearly $257 billion. That's billion with a B. That's a lot of money and a lot of time. And so on average, and again, this might be a little bit lower, but on average, each dementia caregiver today spends 20% more time providing care than a dementia caregiver did a decade ago. And I'm sure you can speak to that a little bit too, Usha.
It is. And, it's especially difficult for me because I work full time and take care of my mom. So, finding that balance is very challenging. It seems like time is never on my side to do what I want to do, as well as to make sure that my mom is comfortable.
Yeah. And I mean, gosh, you do so much advocacy. I know you work really hard to find time for it. And so hopefully a piece of legislation like this Alzheimer's Caregiver Support Act, I mean, if it gets passed and signed into law, which we're pretty confident and hoping that it will, and it's going to provide grants for training, support services for families and unpaid caregivers of individuals who are living with the disease. And also those who are eligible to receive the grants in the communities are like health centers, senior centers, state agencies. And then one of the important things about this is that at least 10% of the funding must go to those who serve caregivers in a medically underserved community. And as you know, Florida again is very rural. It's a big state, so there are a lot of medically underserved communities, little pockets of it here and there in the state. So I think this Caregiver Support Act is going to be really crucial to helping individuals like yourself and the over 1 million caregivers who are currently providing unpaid care in the state of Florida. So I know you advocated for this bill heavily when we were working in your elected officials' offices, and so I really appreciate all your support for that. So I'm going to move on to our third and final piece of federal legislation for this congressional cycle. And this one I really love too, because this is the ENACT Act. In Congress, we love our acronyms. So the ENACT Act is the Equity in Neuroscience and Alzheimer's Clinical Trials Act. And a little bit more background on that. So we were looking at numbers. So in 2018, across all clinical drug trials, not just Alzheimer's, but African American, Black communities represented only about 5% of trial participants, and Hispanic communities only represented about 1%, despite representing 13% and 18% of the population, respectively. And that can be truer in Florida. We have a very diverse demographic down here. And the thing that blows my mind about those numbers right there, Usha, is that the Hispanic population is 1.5 times more likely to develop Alzheimer's disease, and the African American population is 2.5 times as likely to develop this disease. So if we're not getting these diverse communities in clinical trials, we're really not doing enough due diligence on our journey towards one day having a cure for this disease. So this ENACT Act, what this bill is going to do is it's going to provide funding for the NIA to build trust among underrepresented populations, and really by expanding education and outreach and increasing the diversity of clinical trial staff. It's also going to reduce the burden associated with participating in clinical trials. So things like funding new Alzheimer's disease research centers, or ADRCs as we call them, and also increasing the number of Alzheimer's clinical trials in areas with high concentrations of underrepresented populations. So making these ADRCs more accessible so that our more diverse and underserved and underrepresented populations who we desperately need to get in these trials have just an easier time gaining access to them. And then the last thing that this bill is going to do, and I don't say if it gets passed anywhere, I'm going to say when it gets passed, because I have high confidence in this piece of legislation as well, is that it's going to require grant recipients to use community-based engagement strategies in their outreach to underrepresented populations. So again, trying to make clinical trials more accessible to all diverse populations who at times and often are more affected by Alzheimer's disease. So those were our three priority pieces of federal legislation this year. There are just two appropriations requests we're working on. And of course, Usha, as you know, and every time we go into an elected official's office, they sometimes will be like, oh, you're coming back to ask for more money for more research funding at the National Institutes of Health. And my answer is always, until we find a cure for Alzheimer's disease, we're always going to come back asking Congress to continue to increase research funding at the National Institutes of Health. So we've been hitting some incredible research funding strides. We were about 7 or 8 years ago, about at $500 million or less in research funding at the National Institutes of Health, and we are way above the $3 billion mark now. This year, we're asking for another $289 million in increased research funding. So we'll keep increasing that research funding every year, because when you look at other top 10 leading causes of death, like HIV, cancer, before the research funding was hitting that $4 or $5 billion mark, there weren't any treatments or cures, and now we're seeing a lot of treatments and cures for both HIV, AIDS, and cancer patients. So it's really when that research funding matches up with important federal legislation that we start finding helpful opportunities and treatments and cures for these big diseases. So the last one that I'll touch upon, and then I'll give it back to you, Usha, is one of our biggest federal wins. And this was like the first piece of first robust and big piece of legislation that the Alzheimer's Association established, was the Bold Infrastructure for Alzheimer's Act. And this was a huge piece of legislation that works with the CDC to create centers of excellence and provide opportunities for health departments to apply and states to apply for grant opportunities so that they can create these centers of excellence, and also be kind of an epicenter for raising awareness and disseminating information, just like we do for the flu season, but really tailored to Alzheimer's disease. Things like healthy brain tips and healthy living, ways to reduce risk of cognitive decline, and all those things that can really help somebody and a caregiver just gain more information about this disease. Create these little epicenters, these centers of excellence that are helping in each of the states. So this bill, which was, I think this was one of the first bills that you and I advocated together.
Yes, it was. I remember my first meeting was with Congresswoman Val Deming's office in DC, and we advocated for this bill, and it was truly a success and memorable advocacy moment.
Yeah, oh my gosh, speaking of a champion here in the Sunshine State, Congresswoman Demings she has a personal connection to this disease, so she has signed on to every piece of legislation, has supported every appropriations request, and has been incredible. And I remember when we were leaving that DC office, before we even got back home to Florida, she was already a co-sponsor on the bill list before our plane even landed. So that was,
yes.
It was moments like that where we realized that advocacy really works, Usha?
No, that's so true, because that is one of my most memorable moments, besides being in a room full with over 1,200 advocates from across the country being passionate about this. But no, Congresswoman Demings and most of the Central Florida delegation, it's great to work with them, because they do recognize the importance for these pieces of legislation that we advocate for. And to just go back, when you did mention it, because I have heard it several times, when they see us with our purple sashes, they're like, oh no, these people are asking for more money. But elected officials should keep it in perspective, is that money is an investment for the future. Because if they don't invest that money now in awareness and in finding a cure and addressing the various health, issues associated with Alzheimer's disease, this is truly going to become a healthcare tsunami. So that's the reason why I'm even, it's even more passionate to advocate for this, because, we can see the long-term effects, what this will have on the healthcare system. It's, can potentially cripple our healthcare system, and, economically as well, because as caregivers, we see it, how, our families, those who are suffering with it, change from day to day. And it's really fascinating how the brain works. So hopefully, I think that it's great that we've got the support that we do have and that we need, and we just have to keep building it through advocacy.
And gosh, I mean, and since we build so much support through advocacy, and the one thing that I really like to explain to people, which I don't really think I need to anymore, but Alzheimer's disease affects everybody. This is not a red issue. This is not a blue issue. But when you have both of those parties come together for a bipartisan issue, red plus blue equals purple, and purple is the color of the Alzheimer's Association. So this is a bipartisan issue. This is something that members on both sides of the aisle are constantly working on with us. We have amazing other champions, Rep. Demings is one of them. Also, Congressman Rutherford up here in the Jacksonville area has been a huge champion since day one, has signed on to every piece of legislation, is willing to work across the aisles to really work on bipartisan legislation. And I think that's really important in today's, and I hate to say this word, but today's political climate, because we really need members to work across the aisles for big top 10 leading causes of death like this.
Yeah, I think that's the reason why the Alzheimer's Association, the color purple, which also represents caregivers, is so powerful, because this is one area of legislation where they agree on it. And another interesting, I've noticed, as I've been an advocate traveling to Tallahassee, Washington, D.C. these last few years, is that more and more individual elected officials has a direct cause to this disease. So they're able to relate to us and understand, which I didn't feel like it was there, a few years ago.
I love that you brought that up. So our first trip to DC, I think you were on my first trip together like 4 or 5 years ago. And let's see, at first when we were walking into those offices, I'd say about 30, 40% of the members actually needed us to explain what Alzheimer's disease was, needed advocates to share how their family members are impacted. And since we've been back, well, we were virtual this year because of the pandemic, but even virtually, I remember us sitting on all of our meetings for federal offices, and we weren't explaining what Alzheimer's was anymore. They were before we even had a chance to speak, the members of Congress, almost all of them were sharing their personal stories. A friend that's been affected, a family member that they're a caregiver currently. So every year,
even their staffer start opening up to us.
Oh my gosh! I mean, I swear there were staffers in every single office who are like, "We love what you're doing. My grandmother has Alzheimer's. My mother's going through this," and so it is scary to know that a lot of people are being more affected, but it also, I think, really cements in our hearts why we're doing this and why we're so passionate about it and why we're advocating.
Yes. No, and I think, it's nice also when we see members and staffers, they know we're coming, that, they wear purple to show their support. That means a lot as well, too, that they understand, why we're doing what we're doing and to have their support. So even virtually, I saw this year, although we weren't together, in some photographs, it was nice to see members and staffers wearing purple. They always make it a point to say that, which is always, it's appreciated, and it's lovely to see and hear.
It is, and so I always love that, and I love that you brought up whenever we're back in DC with, every year we have a federal advocacy forum where we train all the advocates on our priorities, just like the ones I spoke about earlier, and 13 to 1,500 advocates from all across the country fly into DC. We turn our nation's capital purple. We're all in purple sashes. I mean, we basically take over the Capitol for one amazing and momentous Hill Day. And so they see the purple sashes and they know we're coming, and we're fighting hard that day to get all of our priorities heard. So
exactly. Well, Evan, this is a very passionate subject for both of us, and I know there's a lot of information for our listeners to observe, and hopefully will motivate them to become advocates. So we just have a few minutes left. I want to make sure that you share your information, how individuals can reach out to you if they have any questions. And if there's, I know the 800 number for the Alzheimer's Association is a valuable resource that I've used as a caregiver. I highly recommend it. It is saved on my phone when I need it. So if you can just touch upon that, our final minute or so, please.
Sure. Yeah. So of course, anytime we're doing kind of a podcast or anything like this, we always want to touch upon that the Alzheimer's Association has a 24/7 free care helpline backed by dementia specialists. So this number is 800-272-3900, 800-272-3900. And like I said, this helpline is open day or night. It's backed by dementia specialists. If you're feeling alone, if you're feeling overburdened, or if you just want to talk to somebody or listen to someone or learn about resources, really anything that you need when you need it the most is on that helpline. So please call that when you need it the most, and it's free and it's always available. And the dementia specialists who are on that helpline are just incredible, and they love helping people. They love doing what they're doing. They're very good at it.
Yes, and I would also encourage our listeners to take advantage on the Alzheimer's website, alz.org. There's a lot of virtual programs that are available to individuals. That way, it's an ongoing learning process, but they do it with ease and very, comfortably. So, and I will share, Evan, in my notes, your contact information, as well as if you're on Facebook, I would encourage you to follow the Florida Advocacy page, where you can get the latest news of the pieces of legislation in Florida and, how you can become involved. So, Evan, I wanted to thank you so much for participating in this podcast episode. We planned this about 6 months ago, and it finally happened. And I want to invite you again before the end of the year so we can also talk about some state policies, as well as, what the federal goals are and how we can recruit advocates. So this is a very passionate subject matter for me, and I'm so happy that you were able to participate.
Oh, Usha, it was such a pleasure, and yeah, our team and myself would be more than happy to come back as we're ramping up our state priorities here in Florida to speak a little bit about that in the next coming months. So please let us know when we can do that. And I just I'm again just so blessed to know you and be your friend and just be on this journey with you every single day. So thank you so much.
No, thank you so much. Take care.
Yep.